Good afternoon, everyone, and welcome. My name is Elissa Strome. I'm the Executive Director of the Pan-Canadian AI Strategy at CIFAR, and it's a pleasure to welcome you here to this session today. We've had a couple of last-minute changes, so our moderator, our original moderator, Dr. Mona Niemer, is not able to join us, and so I'm taking on the role of moderator and very much looking forward to a great conversation with my colleagues here today. Our panel today is called Science Will Lead Our Recovery, and really what we want to explore are questions around how science is really helping Canada and the world to emerge from the global COVID-19 crisis. We'll start with some audience questions and some discussion with the audience, and panelist questions and discussion with the panelists, and then we'll move into questions with the audience around 1:15. So I would encourage everybody to have their questions ready and enter them into the Q&A function, and we'll try to get to as many as we can when we get to that session. So just to set up the panel. In the wake of the global health and economic crises, science is crucial to building long-term resilience for a speedy recovery. Canada's research excellence helps protect citizens today and helps rebuild our economy tomorrow. How can COVID-19 inform science policy today and guide responses to future crises? This panel will explore how science and research can support Canada's economic recovery following COVID-19 and what lessons can be learned from the pandemic to prepare Canada's economy in the face of future crises. In the face of this unprecedented challenge and an unknown reality beyond the horizon, what role do science and research play? I'm joined today by some of my most esteemed colleagues from across Canada and around the world. I'll introduce them briefly, but their full biographies are available in the meeting information packages. We have Rémi Quirion, Chief Scientist of Quebec for the Government of Quebec. Asaph Chung, Director General of the Statistics Research Institute for Statistics Korea. Christine Sham, Director of Information Management Strategy and Policy at the Ontario Ministry of Health, and Candice Odgers, Professor of Psychological Science at the University of California at Irvine. So we'll begin by jumping into some questions directly with the panelists and look forward to the conversation. Rémi, I'll start with you. As Chief Science Advisor in Quebec, can you tell us about some of the ways in which science is driving the recovery in Quebec? Maybe you could share some of the accomplishments and some of the improvements that you'd like to put in place in order to respond to future crises.
Oui, bonjour à tous et merci beaucoup. Merci à Elissa et à CIFAR. It's a pleasure to be with you. Like I think in many other places in the world, science have never been as visible during the pandemic. So every day, the Premier of Quebec, with the head of public health, with the Minister of Health, they are on TV explaining where we are, where we stand, why have we taken some decision over another. What was great as well, or still great, is scientists from the public and the private sector that rallied together and decide to work together in an open science way to make more rapid progress on trying to understand the pandemic, the virus, mechanism of the virus, development of vaccine, etc., etc. True in Quebec, true in Canada, and true globally. So really a movement very, very quickly and a lot of flexibility. So that happened quickly with a lot of flexibility. So we have shown that we can do things quickly and differently from the past. Hopefully we'll continue that. So the issue of open science is very important. Quickly, what we did, few examples here, we built a network of experts related to the COVID-19 pandemic, and the network include patients. So working really from the base, the patient with scientists of all shape and form. We created also very quickly a biobank of persons that have been infected by the virus. At the moment in Quebec, this is one of the largest in the world because, of course, in the first phase of the pandemic, a lot of cases in Montreal. But this would be very useful in the future to be able to understand the pandemic and be better prepared for the next one. Investment in research, Canada and Quebec, a lot of investment, various aspects related to the pandemic, a lot of it related to understanding the virus. Where we are now, and I'm sure we'll discuss that more today, is more related to mental health, to toxicomany, to violence, because these issues, the impact long-term of the pandemic, we see that more and more. Some issues, things that we'd like to cover better in the future. Access to data in real time for scientists, not just a few weeks later or a few months later, but very, very quickly, access to data using AI-related strategy, using testing, using tracing, to be able to follow and to understand the pandemic much better, especially now in the second wave, at least in Quebec, but I think it's true in Canada, where it's much more broadly distributed than it was last spring. Also to expand public health, to be able to have something in public health, yes, better long-term investment in public health, but a more diversified group. So different type of expertise joining force with public health experts to be able to control the pandemic much more in the future. Also, the public explaining very plainly what it means, what this pandemic means for the public. Early on was a bit easier to control the message and to ask the public to be very much involved in the terms of the control that were put in place. Now many of us are getting tired of all these kind of limitations, start to have a bit of problem with mental health. So the message to the public is absolutely essential. And in the end, something that we have tried to do a lot here over the past few weeks, few months, is to say to the government, our government, science is very much on the forefront. You talk, you as premier and minister, about science every day. When we're a bit out of that crisis, make sure that science is still on the forefront. Because of course, on our government, the ask from various parts of our society will be huge. But still, the only way to get out and to have an economic recovery is science and innovation. So we have teamed up with large company, with CEO all over the place to say to our authorities, our minister, our premier, we need to continue to invest and to invest more into science and innovation over the next few years. That's the only way that will be able to prevent and better manage future pandemics. Merci beaucoup.
Merci beaucoup, Rémi. Very well said. We'll dive into a few of the questions, I think, once we get through everybody's opening statements and questions, because I think you raised a lot of issues that are common across our panelists, and we'll have opportunity for a great discussion there. So Young, thank you for joining us from South Korea. It's really a pleasure to have you here with us and to see your face again. We're very interested in the South Korean response and the very science-based approach that you've taken from the very beginning. We know that South Korea faced an outbreak of MERS in 2015. How did that experience inform South Korea's response to COVID-19? And what role did the international community play in today's response or this year's response to COVID-19?
Sure. Thanks for inviting me to this panel. I prepared, I think, a few slides to share with panelists and then the audience, because I think that a picture is worth of I think the 1,000 words. So let me briefly I think show some of these slides in response to your question. So basically, I would say the best practice of science in Korea in response to this pandemic has been sort of evolutionary. I would not say it is revolutionary, but it is evolutionary because we have learned the lessons from the past. I think including the MERS and then SARS and then other pandemic or epidemic experience across Asia. So that's something that I'm going to tell you a little bit more about. But let me kind of give you sort of, today's snapshot of where things are before I go back to a few years ago where things were. This is actually one slide to show how OECD countries stand when it comes to response to the COVID-19 and then performance. This is not a slide to brag about how South Korea has done better than many other countries. I would say rather, this is kind of the only snapshot of how I think the different countries have done in response to this COVID-19. And, this Sustainable Development Solutions Network 2020 has just released this report summarizing so-called COVID index based on, how many, I think the people died from this COVID-19 and, this reproduction rate that we all are using to create the epidemic curve and other intervention measures. And also there are some other measures like epidemic control efficiency and then mobility decline and things like that. So Korea, Australia, Estonia, Japan, Slovenia, New Zealand, and Norway, they are all belong to this, sort of top 10 countries when it comes to performance index. Of course, there are many other countries, but this is kind of good indication of how many countries in East Asia are doing well in response to this pandemic we all experience. No, I think the one important difference the countries like Korea in East Asia, I think experience is that this March outbreak back in 2015, and we also had experience with the SARS, many years ago. When we had that kind of, I think the outbreak that actually was very important, I would say, sort of vaccine to help us be better prepared for the future epidemics and then pandemics that we are experiencing today. And also that helped us to, I think, to institutionalize some kind of like legal guidelines. What is the public good that we have to support? And what are the individual rights and privacy we still have to respect? So in consideration of those kind of dual concerns, we came up with sort of a legal structure and the laws to support the public good and also the respect the privacy. And because when we do the sort of 3T system of testing, tracing contacts and treating in isolation to flatten the epidemic curve, and still, we got to sustain the economy. And also, I think keep the social life going on. We got to have pretty good science foundation in all this the 3T system. I think that we have been using since the last February. But again, I'm just telling you this I think experience that we had with MERS and then SARS was a very important, I think, a vaccine for South Korea and many other countries in East Asia. And based on it, we are able to come up with some kind of, scientific, I think, approaches, including near testing of the COVID-19 and what are the scientific interventions that we have to actually, create, and then working together with international the science community. And I like to just, point out this, the law that we have actually institutionalized after this MERS outbreak in 2015. I'm just showing you this so-called Infectious Disease Control and Prevention Act that I think we institutionalized back in 2015 when we had this MERS outbreak. This was very important. I think the law the National Assembly has put together in response to, in preparation for any future the epidemics and then pandemics. And so that is good enough to tell you how we have been preparing for this kind of pandemic even today. There was some additional sort of advancement of smart quarantine info system we created back in 2017. We didn't know that we had to use that kind of system in preparation for today's crisis, but that was very important foundation when it comes to the data-based and science-based system that we are able to use since this outbreak of the pandemic COVID-19. And today, I think we are also using a lot of this big data system for precision tracing, including the use of AI, so we can track and then trace all this patient's movement and then context and so on. And we are also using a lot of other, the location data, mobility data, and also the card transaction, so we can actually locate, especially the movement of the patients and then some of the important contacts. I think by keeping higher level of privacy, and we don't want to disclose some of the really private information to the public. This is just illustrate, I think how we are using this big data to understand, I think how our predictive model is actually working. So we could actually measure, mobility of the population in comparison to their movement the past year, whether the people are actually following the social distancing measures the government has in place. So this was very important big data analysis that we have done as part of, forecasting the behavior of the COVID-19. And, this is just another snapshot of how we measured population mobility based on, the phone data that we were able to use in concert with, the mobile phone company. And this is also another, I think, snapshot of how the people's behavior have changed since the outbreak. This is to show the pattern of this face mask wearing and by country. So we have quite a few countries in the Western Europe, and then many other countries in East Asia. You can see the pattern here. Many countries in East Asia followed this mask wearing from the start back in March. And most other countries in Western Europe picked up the speed, I think, since May or June. And that is important, I think, the change of the behavior when it comes to, the face masking. And this was very important, I would say, perhaps the vaccine, I think the behavior, that I would say even stronger than actual medical vaccine that we are all anticipating to use in the near future. And I have just a couple of more slides to share with you in response to your question. Again, the point here is that science has been the foundation of our response. And so when it comes to knowing about how this COVID-19 is behaving, we try to actually predict how it is going to actually go up, down, and so on, depending on different, I think, the waves. So initially, we learned a lot from Canadian experience when it comes to this so-called, SIR model-based idea. I think initiated by David Fishman of University of Toronto, and then his colleagues. And the Korean colleagues have also developed their own models. I think the sort of variants of the SIR model. So SAIR, SAIHR, and other data science-based, the model, the prediction. And that was very important foundation. This is just to show, this dynamic distancing we have actually applied to the Korean context. So we actually talked with David Fishman back in April, and whether this kind of theory and methodology can be actually implemented. And it took some time, but we did real-life experiment in the Korean case. So we were able to show actually within the capacity of the health infrastructure, can we control and then harness this COVID-19? And we can still, I think, manage the social and economic life. And so this is the methodology that I think that we learned back in the spring, and then we actually applied it. So we can see the actual pattern. This is the modeling that we have done back in May, and we actually saw sort of this repeat of the other small waves. And then this is the kind of the pattern that we're able to keep while sustaining economic and social, I think, the activity while we are actually managing the COVID-19. And this is another sort of prediction model based on the data science approach. And another important thing I think I'd like to add before I wrap up, I think my response to your question, when we are doing all these science-based approaches to harnessing this COVID-19, we are also very concerned about, I think, people's social life. And we actually we try to measure how the suicides have been actually changing over time this year in comparison to last year. Because we are concerned when people are isolated because of this social distancing, whether we are going to have more episodes, more attempts of suicide and actual suicides. And actually, we found among the females, there has been about 20 to 25% of increase of suicides this year. So we are very concerned. We are actually trying to do some, I think, the further measures to, I think, decrease this kind of very, I think, the tragic sort of, I think, the instance among female population. Again, in conclusion, I would say that science and data science is a trailblazer. We have SEERS, I think to do this nearcasting to predict the pandemic curve. And we've been very concerned, and I think with how best we can use the interdisciplinary, I think best practice when it comes to, keeping this COVID-19 in control. At the same time, we have to sustain economic and social life. And lastly, we got to have science-based policy making, and that is, I think, what we are all trying to go after. And again, this is the just one painting that I love. This is painted by the John Miller, back in 1970. He saw the sky in Spain, and he came up with this painting of the SEERS. To some extent, I think the scientist, trying to predict the future with the data and science, and then so we can be better prepared before things happen. And that's the role that we are taking as a scientist in today's term. So that is my response to your question, Elissa.
Thank you very much, Young. What a fascinating overview of some of the really powerful examples of how science-based approach has been implemented in South Korea's public policy response and public health policy response to the pandemic. I really appreciated, the recent data that you shared with us around the impact on mental health and the very intentional and proactive investigation of that issue, because of course, I think we all know as we're heading into second waves, that mental health is really, really starting to have an impact, and that will continue to grow. And your data showing a 25% increase in suicidality amongst females is really troubling. But that data, of course, is what can help inform our public health response. So it's so essential to have it. Thank you for that. Okay, we'll continue on with our questions to the panelists. So Christine, I'm coming over to you next. In the midst of the pandemic, the Ontario government has deployed the Ontario Health Data Platform. It's been a pleasure of mine to work with you and colleagues in thinking about that platform. The Ontario Health Data Platform is designed to provide integrated data access to researchers using advanced machine learning and artificial intelligence and other data science and epidemiological approaches. Can you talk about what you hope to achieve with the Ontario Health Data Platform and why it's so important, particularly at this time?
Sure, thanks, Elissa. So when the pandemic hit Ontario, there was a recognition that a lot of very complex decisions were having to be made without necessarily the benefit of analytics. It was science, research, or even data. And so it was out of that necessity that the Ontario Health Data Platform Initiative was created. So we short-circuited a lot of the traditional policy environment that's in place around the use of data, because it's currently very difficult to combine and link data. It's a very onerous process. And so basically we short-circuited that system to compel all of the data and put it in one place, beginning with administrative data sets, but moving on beyond that. But if I had to summarize in terms of what we're really trying to get at, obviously priority number one is to support evidence-informed decision-making around the pandemic and leveraging these advanced analytical techniques. And I think that's first and foremost the business imperative that we have. I think that the second thing is that we're really also trying to, at the same time, build a data ecosystem for research and address some of the systemic barriers there have been to sharing and using information for research purposes, while at the same time also ensuring privacy protection. I think that the reality is that the reason why something like this hasn't already happened is because it's actually quite difficult to do. And even in thinking about using data, we've had to also address the question of building capacity in our research community to even work with the data. There's been a lot of interest from our research community in contributing to the pandemic management effort, but it's something that we need. The capacity is something we need to factor into our approaches to dealing with this. We know that this data platform is going to be useful not just for pandemic management purposes, but the hope is that this will eventually become a long-term government-sponsored research platform. So what do we need to do to shift the environment and to put into place the necessary policy framework to enable this to happen? And I think the third thing that we're also trying to achieve is to engage the citizenry in a conversation about the use of their data, because this is something we haven't done before in the past, not at this scale. And given the scope and breadth of the data that we could be contemplating for use on the platform, it really is a very fundamental conversation that we need to have with our citizenry about the use of their data to make sure that there's transparency and civic engagement and support for this. So I'll talk a little in a little more detail about each of these sort of objectives and what we're doing on this front. So in terms of supporting pandemic management decisions with research and analytics, the government has set up a challenge questions registry. So this reflects the research questions that are top of mind for the government that we're hoping to appeal to our research community to have them tackle that. So we have 7 broad research areas that we're looking for researchers to tackle, which includes vaccination strategy, therapeutic treatment options and outcomes, looking at the different pandemic waves and prediction, testing and surveillance strategies, population level prevention and containment, health system resourcing, and last but not least, health equity and impact to vulnerable populations. And so through a broad consultation process in the province that included our research and health system and clinical community, as well as decision makers, this list of challenge questions was developed and is publicly posted now. And so we've issued it as an appeal to the research community to contribute and to undertake research that's related to these domains. So the challenge questions were published in the July timeframe, and we started to receive a number of applications for researchers interested in tackling these questions. So we're hoping that this will be a fruitful, policy and research collaboration on tackling some of these challenges. We are opening this up to not only traditional researchers, but also hoping to take advantage of advanced data science techniques, including machine learning. So we've been having a lot of dialogue with the research community, and I think that one thing that has been achieved is really that closer cooperation and collaboration, not only on these research questions, but on the design of the data platform itself. And I think that's, one of the other goals that we have. We know that data-driven research is really the way of the future. Data-driven research isn't obviously the only kind of research that is conducted, but I think you'd be hard-pressed to find too many researchers who wouldn't benefit from having access to additional data sets to complement their research. And so there's a really recognition that we have to tackle some of the systemic barriers that make it very difficult to use data for research purposes. So at the same time that we've had a very pragmatic look at how to tap into data and research, we've been thinking certainly about the longer term, and there's a strategy process that's been launched in the province to tackle some of these barriers. So looking at data governance considerations, infrastructure modernization, data quality issues, and so on. Because the reality is that as we move into this sort of data-driven kind of research world, we have to make sure that some of our foundational underpinnings around data quality are addressed. And so all of what's happening right now has really shone a spotlight on data policy and data governance issues. And so we know we do need to tackle this for the long term. Even taking a look at privacy legislation and modernization and how we need to protect data and privacy in a big data context are top of mind. I think that the interesting thing is that many jurisdictions have come to a similar realization about the need to undertake all this work. In us undertaking this project, we have been talking to other jurisdictions, and I think we're all experiencing similar challenges on this front. And working with data sounds like it's a really easy. It's very intuitive to us because in our day-to-day lives, we generate and have access to so much data. But when it comes to structured and unstructured data for research purposes, there are a lot of other considerations that we have to take into account. And what the pandemic has really brought into focus is the need for us as a jurisdiction and a healthcare system to really work on this in a concerted effort to figure out how we create a true data ecosystem to support research. We've started with health administrative data sets because those are the easiest, but we do have a data strategy that will start to broaden that out to look at clinical data sets, for example, as well as other kinds of data sets that researchers might be generating through their own clinical research, for example. And even beyond healthcare, we're also starting to look at the idea that we might be bringing in data sets from other sectors, social services, education, and so on. So the future of the data platform is really it is a big data approach that would be multi-sectoral. So obviously we're still a ways to go from that. And even in terms of some of the questions that we're trying to answer and tackle right now, there's a recognition that the data that we have isn't necessarily sufficient. So we are trying to tackle the data strategy side of things as quickly as we can. And I think that on the third topic around engagement of the citizenry, I think this is probably one of the most important that we need to tackle, and that it's a really important topic for us because when it comes down to it, we're using citizen data to undertake all of this. And I think that one of the things that we have to consider when we think about data governance is the longer term data governance considerations around how we define and articulate the public good around use of things like big data. And that really requires a policy conversation and dialogue with the citizenry. And there are a variety of approaches that we can use to tackle this. I think even thinking about the ways in which we would protect data and apply those protections, that really is a conversation about the citizenry, about their views on the use of their data. In a big data context, I think from my perspective, data is not just it's not just information. Data about a citizen really is like the citizen, a representation of the citizen themselves, especially in a big data context. And so we're really having to have some very fundamental discussions and dialogue about how we talk to the public about that in order to really build the future data ecosystem for the research community.
Awesome. Thank you very much for diving into the main policy considerations and details and approaches that you're taking on the OHDP. I'm just going to jump in really quickly to share with the audience some of the work that you and I have been doing with other jurisdictions across the country in Canada since the COVID-19 pandemic began. Christine and I have been getting together. CIFAR has been convening health data leaders from across the country in a working group to talk about initiatives just like the OHDP that are happening in Quebec and in Alberta, in BC and others. And where can we be learning from each other? Canada is a very big country. We don't all know each other because our health systems are delivered by the provinces and territories. There isn't a lot of exchange of ideas and collaboration happening. And that's a real barrier. I think that we have so much to learn from each other. And we've experienced that, Christine and I and our colleagues, over the last several months. And we're looking for real opportunities to collaborate on items that are and issues that are shared interests across these many jurisdictions. And one of them is public engagement. A Canadian in Ontario, deserves the same level of engagement as a Canadian anywhere else in the country. And, that I think is a tremendous opportunity for us in Canada to really start to talk to the citizens and not just talk to them or at them, but actually start to engage them in many of these initiatives, in the building and designing of these initiatives and programs, in the governance of these initiatives, and truly embrace public engagement in a meaningful way. So that's a great opportunity on the horizon, and we'll look forward to more collaboration and coordination across provinces and territories on this in the future. Candice, over to you to give us a slightly different perspective. Your research is really fascinating, and I'm really looking forward to having you share it with our audience. Many have said that the untold stories of this pandemic are the social isolation, and a few of our previous speakers have spoken to that a little bit, and its potential negative social effects today and the longer term consequences on children and on families. Tell us what your research is showing. And are you getting the attention needed from policymakers for your work to make a difference?
Yeah, thanks for having me. So my comments today are going to be structured mostly around children, in part because I co-direct for you the Child and Brain Development Program, and that's where my research is focused, but in large part because they're often left out of the equation and in the solutions that we're thinking about, whether that's in terms of access to their data, as Christine has talked about, or in terms of thinking about the long-term impacts of how this might be touching their lives. I just wanted to start off by saying that I'm sitting here in the United States as a Canadian, the day after what has been a referendum, I think, on science as part of the recovery. And I think many of those of us who are working hard in terms of the interdisciplinary science space to bring that solution are looking at countries like South Korea and Canada with a lot of envy, especially this morning, as there really was a referendum on where science fits in the solution and how important COVID is in the months to come. And so for that, we look to you for leadership and for the great work that you're doing. So I just wanted to start off with that. It's great to go last because there's these great themes that I think kind of connect throughout. And one of the themes was, Rémi, Young, Christine, they all mentioned this, was this need for really big tent science, and that the solution's coming really in terms of bringing in the behavioral as much as the efficacy of a vaccine, right? And I think that is going to be especially true when we think about children. So trials are just beginning with children. Those are going to be the last pieces of data that we have. There's a lot of controversy around messaging around vaccines in children. And one of the biggest concerns in terms of child well-being has been cutting off children from educational institutions, from the institutions that support their daily lives. So I know that the recovery has been faster in Canada and South Korea, but there are many children, millions of children in the United States who have not been back in a school yet since this started in March, and who may not be back. And many of those are the most vulnerable children that we're seeing. So big tent science is going to be kind of important, and hopefully science here in the US will discontinue to be relegated and sidelined in the solution. So that's kind of the first issue. The second issue is this idea of hidden costs of COVID for children. And so my colleagues and I in the CBD program have put a few position papers out, really thinking about, many people view children as being spared from the pandemic because the infection rates may seem equal, but the actual rates of sickness and certainly mortality have been much lower. But one of the things that this has done is disrupted their lives in really important ways. We know the economic shocks, the family stress. We know that young people, adolescents, were in the midst of a mental health crisis before the pandemic hit. So these have been big disruptions. We also know from other types of shocks, so both the Great Recession in the United States, going back further than that in previous recessions or natural disasters, for example, the Quebec ice storms, that the impacts of those events on children, the imprints of those can be seen for years and decades to come. So children have not been spared the virus in terms of those things we know impact them, their lives, their future opportunity. Now, one of the things that we know also is that there are unequal impacts. So it's not the case that the entire generation of children are being impacted in the same way. And it is typically the case that those most vulnerable, those with the most precarious family resources, for example, will receive multiple hits throughout this. They will be more likely to know individuals who have had COVID, who have been very sick from COVID, whose family members have lost a job, who've had increased stress during this time. And so targeting supports and resources for those young children, including opening selectively educational centers for them, including the increased transfer of resources to keep their families out of the more and more precarious socioeconomic status during that time. So the economic shocks are the real concerning part in the family stress in terms of long-term impacts. Of course, there are some physical health impacts that we don't fully understand yet in terms of what those will mean for the large number of children who have already been and will be impacted. And the third thing I wanted to point out, and it was interesting, Young, when you talked about the increasing rates of suicide that you're witnessing. This has been something that everyone has been holding their breath in the mental health field, and especially with adolescents. In the United States, there has been an increase in suicide among every single age group for the past 10 years. Right, and we've seen this increase, and we've seen it's been especially strong or disproportionate among young girls. And so, coming into the pandemic, there were a lot of fears around youth mental health and whether or not this might exacerbate that. Now, I don't think we have great data on what's happening now, but what we are seeing is that the pandemic has certainly been a disruptor in terms of how we reach young people, in terms of their digital technologies. And so this is an area we do a lot of research on. We spend our days tracking young people on their mobile devices, tracking their digital device use and their mental health and daily life. And even before COVID hit, young people here were spending on average more time in digital spaces than they were in schools. Right? We are increasingly seeing young people going online to seek out information and help for mental health. So in the same way, and I know Ontario has been leading in this, there's been a movement to digital health and telehealth. There are young people who are high need, who are increasingly going online to search out information on mental health, to download an app and to receive treatment. Now there's a gap. My colleagues and I recently reviewed the kind of available digital mental health treatments and apps that are available for young people, and there's a gap. There are a lot for adults, there are a lot for young children, but this adolescent range has really been neglected. And what we're seeing is that we have young people downloading or expressing an interest in downloading apps, but not using them. So we need to have this way to connect technology, those institutions, so whether it's school counselors, whether it's mental health providers, ways to scale and extend the reach of their practices. There's been some recent research at the college level here where most of the digital mental health or the mental health services have gone online. And surveying those young people after the fact, it's been clear that they would prefer, even when face-to-face comes back, they prefer to stay online or they have no preference. So there's a real opportunity in terms of kind of innovation, how we can reach people. But this becomes a data security and privacy issue also in terms of how you can reach, how you can store, how you can protect that data as we go forward. So those are the things that we spend a lot of our time thinking about. That is, how we can best integrate the behavioral science to change the tide of behavior and thinking about bringing children into the solutions in what is a very tough policy climate here to have science at the table at the moment. The hidden costs and the unequal impacts in terms of which young people and families are going to be disproportionately impacted and how to get support for them more quickly. And this pandemic as a disruptor that is creating some windows to reach young people where they're spending most of their time anyway through tools that they're more comfortable using at a time where mental health needs are likely to be high. So can we advance the science of just-in-time interventions of tele and digital health during this pandemic to kind of offset some of the long-run negative consequences we're all worried about? So thank you.
Thank you, Candice. You've shone such an important light on an issue that is often hidden from sort of discourse and from science and from policymakers. So it's really important that we take a look at children and adolescents, of course, because they are the adults of tomorrow. And this pandemic is really having such a tremendous detrimental impact on, a whole generation of young people that are going to be our adults in not too long. So thank you for that. And, I really appreciated your focus on technology as well, because that's where I wanted to go next with the panelists while we open it up for a few minutes for discussion amongst ourselves as easily as we can in this format. I wanted everybody to sort of think and reflect and share your thoughts on what is the role of technology. What do you see as the role of technology in our public health response today and in the future to pandemics like the one that we're in right now? I'm going to just choose somebody. How about Christine? You go first because I know you have to leave us soon.
Sure. Well, for me, it's actually less a question of technology and more a question of information, because the technology is really just a tool for engagement. But I certainly think that we have lots of possibilities to explore innovative new ways of doing things, and I think that's the opportunity that we haven't. It's been very theoretical in the past, but I think that with where we're at right now, I think that we should be looking at all of the options that we have to reimagine the way that things can be done. The reality is that in our current situation, we are able to short circuit the normal rules, the normal processes. There's a new heightened urgency to doing things, and not only that, a business or system healthcare delivery need to reimagine ways of doing things. So I do think that we should be taking advantage of what we can right now. We've been talking about things like digital transformation in healthcare anyway for a long time now, and progress has been slow for whatever reason. So I think that is first and foremost top of mind. But I think that the other thing we also need to consider is really what is really the big data world that we're in right now, and what do we need to do now to address some of those policy issues to allow us to think about how we can use all this information that's being generated. The questions are not so much about using information for healthcare delivery purposes. The biggest questions now are all around the secondary use of the information, regardless of the technological mechanism. And I think that that's really a big stumbling block that we have before we can really in a more meaty way kind of engage in a lot more of those types of activities. And that's why, I think it all does come back to having that dialogue with the citizen about the use of their data. So I think we need to set ourselves up with a strong foundation around data and digital rights to then kind of enable the rest of the potential to follow.
Awesome, thank you. I'm gonna riff off of that theme and move on to engagement of citizens and public engagement and inclusion. Young, you shared some of the work that's happened in South Korea to change the laws, to make the legal frameworks much more amenable to these kinds of responses to public health. What about engagement with citizens? How closely is communication with citizens? And tell us some examples of how South Korea includes members of its society in sharing the science and the science-informed policy decisions.
Sure. I think I can tell you about on the two the fronts of how the civic engagement has been in place from the start. I would say the first sort of top down and bottom up approach. When it comes to top down, I think we actually initially wanted to say things very straight from the political leadership group to the ordinary people via all media tools. I think we even in a week or two we noticed that is not proper approach. And it is not good when it comes to crisis management and crisis communication and then proper way to handle COVID-19. It is not the political leaders' the role to communicate with the ordinary people. So I think the group of scientists and then National Research Council and so on, we actually advised very strongly from the start. We have to give the communication leadership to speak with ordinary people, to the scientists, the people in charge of the COVID-19, the Korea Center for Disease Control, the leadership group. So they are on the front line. They are on, the daily, the announcement of how things are in the morning, in the afternoon. And so we directly talked to the public. And then by using this, scientists in charge, rather than political leadership groups' communication to the public. That is the one important, the system that we had in place in the past 8 to 9 months, and we keep trying in that way. Give the leadership to scientists rather than political leaders when it comes to this kind of pandemic crisis management. Second, how best can we actually get the civic leaders and the citizens be part of this crisis management system? So we actually created quite a few committees when it comes to the actual policy decision-making process. For example, as recently as just a month ago, when we were deciding to change the system of the 3-phase intervention to 5-phase, why we have to do it, and what are the sort of interventions that we have to have when we change the 3-phase system of the interventions to 5-phase the system. So we actually talked with this, the standing committee that includes the important leaders from all walks of life, and then scientists as well. And so they were part of this decision process when it comes to important the change in policy intervention. There are many other ways that we have actually involved, the civic leaders and different, the leadership group from the citizen group, so they can be part of this intervention, the system that we have been keeping, changing, and then transforming. And that is going to continue. And I think even for the next year, when we talk about and when we are preparing for different sort of, I think the pandemic wave, and we keep having all this the citizens be part of this I think intervention governance system, and that has been very important philosophy that we have been trying to actually implement step by step. So that would be my response to your question, Elissa.
That's great. Thank you very much for sharing that, Young. Rémi, over to you to share with us the Quebec approach to both sides of this equation. You mentioned it a little bit in your opening remarks. How important is it to have scientists visible as leaders in our response to the pandemic? And how have you in Quebec engaged citizens in the conversation, in some of the policy discussions, etc.?
Yes, very good. Thank you very much. I must say at the beginning that I'm kind of jealous of South Korea, that what you learn from SARS, I think in Canada, we did not learn much from SARS. So we put aside and hope that it will never happen again, something like that. So you learn from that, and that's great. Hopefully Canada and the province will learn from the current pandemic. In terms of artificial intelligence, quite early on, probably many of you know about the Montreal Declaration on the ethical issue, on the ethical use of AI. And that was developed with citizens, with engagement from citizens working jointly with scientists to develop the Montreal Declaration. On that phase one, I'd say, then we developed phase two, with the observatory, having an observatory that will monitor activity locally, but also globally on how we do business. And the observatory was useful during the first phase of the pandemic, looking at, for example, various apps for tracing. Maybe it slowed down a little bit some of the decision of our government because they were kind of waiting for consultation at the level of the general public. But I think overall it was a good decision. Then I mentioned also we created the network, the COVID network, with 3 leaders, 2 scientists, one more on the clinical side, one on the basic science side, but also a patient. So that person is the link with the base, with the citizen and with the patient group, to be able to have them involved every week on the decision of the government and the network, or where to go next. One concern that I still certainly have is a digital literacy. Candice talked about the teenager, about the young adult that are very, very savvy. They do a lot, and now it's a matter more of saying, okay, yes, they go on these social media type of platform. What about misinformation there? What about the right type of information? How to engage them? To say, okay, yes, maybe they could be very, very useful to talk to their colleague, with their friend, teenager, about the pandemic and the impact it will have in our society. But where I'm quite concerned also is about all the other group in our society, the older citizen in our society that often are a bit, let's say, afraid about digital tool. Also, how do we engage them in the whole process? Certainly in Quebec, I say that we need to work much more aggressively on that side so that no one is left behind. Another one, and I'm sure like Toronto, of course, is one of the prototype in the world. We have many, many, many different community in our society. Like in Montreal, citizens speaking different type of language. Most of our communication in Montreal has been with French-speaking people, citizens, and English-speaking. We did not think too much of the others. But basically, these community often do not listen to French TV, don't read French paper, or English paper, or English TV. How do you reach them? Also, I think it's still a big challenge for us, and bringing digital literacy there as well is certainly a challenge for us in Quebec, and I would think for Canada as a whole. So we need to work much more strongly on all aspects related to digital literacy.
Great, thank you. Audience, we're getting ready to open it up for questions and answers. So now is a wonderful time for you to start putting your questions into the Q&A box. And I'm gonna shift my attention to Candice and ask her one more question, and then we'll start taking some of the audience questions as we head into the last element of this panel. So Candice, I think Rémi's point is really interesting. You know, in the populations that you work with, the children and adolescents, what we actually have are, you know, early adopters and very technologically savvy users. They have totally different perceptions around privacy than other populations do, which is quite interesting. But are there things that we can learn from how children and adolescents engage with technology in order to inform how we can advance digital literacy in other populations, whether it's different age demographics, different languages, as Rémi spoke to, or other different demographic measures?
Yeah, so I think that's a great question. I think we're leaving a lot of talent on the table when we exclude young people from the design process and kind of thinking through solutions. And we've seen that with the US college experience and bringing young people back. These are young adults that would have all kinds of interesting ways and ideas of keeping their communities safe. Yet university administrations brought them back with these kind of stagnant protocols, a top-down approach, an authoritative kind of approach to, and we saw outbreaks, right? When we saw outbreaks, closure of universities and spreading, right? So just those examples. These are young people between the ages of 18, 24, kind of at the peak of kind of cognitive ability, innovative, out-of-the-box thinking, some of the smartest young people in the country, and we don't engage them, right? So that's one kind of example. The other one is I think that we've seen this, you know, kind of history and kind of what's happening pre-pandemic can inform a lot of this too. We see all this promise and hype around the tool, and Christine alluded to this, right? You know, she's not as excited about the tool as kind of the use of the data or kind of leveraging technology for a specific aim. I think we're seeing the same thing now, that, you know, kind of digital tools or apps might be a solution, and can we just get the literacy into older adults versus thinking about how can we use the technology to kind of leverage the other types of infrastructure and supports we have and already know that work. And to do that, and especially with young people right now, there's this development of kind of apps and solutions with little consultation of them. That is bound to fail, right? And we've seen this time and time again in terms of the promise of precision medicine, right? Or in terms of the promise of digital mental health so far that hasn't really been able to kind of close these gaps as we wanted and we thought about. And so I think there's opportunities to do that at kind of all segments of the population right now. You know, there are definitely challenges because the in-person contact is limited in terms of the co-design and in terms of kind of bringing in citizens from across those groups, but it's possible, right? It's possible, and I think it can be done and it should be done in order to take these kind of tools that we have and leverage them in ways that extend the good that's being done kind of every day by different sectors of kind of government and health and services. And we're seeing this in education right now at a massive level, right? So our schools right now are stretched, just bringing children in safely, right? Thinking about how to reopen. At the same time, there's this influx of issues and need for support. So we're having these technology startups appear out of nowhere, educational systems having no real way to kind of vet the quality, the durability, the effectiveness. And here is where, you know, kind of team-based approaches to ensuring not only that we have kind of a reliable product, right, the one that will be sustainable and one that will work, but one that will be attractive to young people, right? So one that they will actually use and will support them. So we're at an interesting place in terms of innovation, but I worry a bit about repeating kind of the patterns of the past of excluding kind of users in the design, of assuming technology is a solution versus the tool.
Yeah, awesome. And you know, your points really apply to every population that we're talking about, right? So as we're designing technologies and approaches specifically for an audience of children or adolescents, of course they have to be engaged in that development. Same thing when we're talking about developing technologies, apps, approaches for particular other demographic groups, whether we're talking about older citizens or speakers of particular languages. I think we have to include them as we're developing them. It rings true for me when we think about applying machine learning in a healthcare context. That's something that I spend a lot of time thinking about. We can't just do that, for instance, without including the clinicians and the hospital administrators in the initial conversations, asking them simply, what is the problem that they have that maybe the data and the technology and the tools can help us to solve. So that all of that really echoes back to our theme about public engagement, and public engagement not being simply talking at citizens or patient groups or children, but actually including them in these processes that are informing scientific approaches that we're taking that are informing policy that affects their everyday lives. I think these are lessons that we can apply and learn to so much of the policy work that we do. Okay, so I'm going to move on to audience questions now, and we've got a few that have come in. The first one I'm going to address is directly to Rémi. It reads, many countries like South Korea, Taiwan, Singapore successfully managed to control the spread of the pandemic through wide use of surveillance technologies. Considering the current second wave scenario, do you think these can be considered in the Quebec context? There's a controversial question for you.
Yeah, certainly we had a lot of discussion on that. I mentioned the observatory. A lot of discussion with AI expert in Montreal, with the Mila, with companies like Element AI and the big GAFA. And of course, we went back and forth saying yes, saying no, and then saying, well, you need, if you want to have a ready to make sure that this is useful, you have to have a large proportion of the population that will adopt them. So there, my own bias is that we kind of wasted a few months on that one. Maybe rightly so. I think that we had to have the support of the citizen in the discussing with that. But in the end, since the second wave was happening quicker than some of us has expected, finally the Quebec government said, yes, we'll adopt the federal proposal, the federal apps. We'll see the impact. It's still early days on that one, but quite a few Quebecers basically download the app, and now hopefully we'll be able to use that in terms of tracing to be more efficacious, because I must say that we have not done a great job there up to now.
Thank you. This is a great opportunity to plug that app. The COVID Alert app is available for many Canadians, but still not yet all Canadians across the country. And we're starting to see it being effective in alerting people that they may have been exposed. So it's one step, one tool in our belt that we have today. Young, do you want to comment on the use of technology and contact tracing in the South Korean context?
Yes, I think we touched upon this issue. I think in this discussion. And again, I would say we gotta do it in a kind of evolutionary way when we consider marriage of technology and also human factor at the same time. Using technology itself has been I think quite helpful to do all this. Testing, tracing, and then treating the patients in isolation. But at the same time, I think I see the sort of the opposite side of I think the downside of using all this technology. Again, we talked about the privacy and confidentiality. But I'm also very concerned about what kind of human factor are we losing when we are too much focused on using technology. I think Candice and then a couple of other people mentioned touched upon that aspect. But I'd like to again reiterate we got to be more concerned about how best we should not lose the human factor when we are thinking about when we are harnessing this COVID-19 and then using the technology to control it. As we go through, the several months of, I think defending the people against this COVID-19, I'm increasingly more concerned about, can we actually, live with it, and then we can grant some I think the amount of this COVID-19 infection while we grant the children, young people, and then other people to have more social life. And then get the young children actually, stay in schools as long as we have the manageable system of the that 3T system that I just told you about. And so Korea has been actually, using a lot of those tools of technology since the outbreak. But there are times that we decided, okay, we got to, keep young children in isolation, and then we continue the online schools rather than offline schools. That was the very difficult decision, but we had to do it. I think back in the spring and then summer, and we changed the tactic strategy. I think in the second half of this year, can we actually grant children going for the offline schools and get them this, the socially engaged instruction rather than this online school that we think we can handle pretty well using technology, laptops, and then all this, the remote, I think the connection that we are able to connect entire country, all children, I think across Korea. But I think once we thought more about this human factor and then how best we should not lose this human engagement, especially among the young children, that human engagement is very critical, when they are young. So we decided actually, as recently as just a month or 2 months ago, now all children are now in school. This is very important change. We thought we are ready, technology-wise, using the 3T system, we can handle, whenever the small, local outbreaks are happening, we can handle it. But we are going to grant them more, I think, the freedom and more social engagement and human engagement, so they can, I think, the gain from all those the human factors and human engagement. So I'm just kind of illustrating, why we should not lose the human factor when we are using this technology. We know enough about how best we can use it, but perhaps we know less about how much we have to keep the human factors in all this, I think, the relationship building and then social engagement and then civic engagement that we are just discussing about.
Yeah, absolutely. As a parent, I saw it in my own children. They went back to school in September, and they were changed people. They are very happy little people because they're amongst their friends and they're with their teachers and they're engaged and stimulated all day long in a way that they weren't when they were going to school from home. So it's essential. And I think another dimension of that is right now, many children are separated from their grandparents, and we're seeing real impacts on those social bonds and on the mental health of the older generation. And I think that's another strong point to make in support of what you're saying, Young, around the human factors approach and making sure that we have that balance between technology and our need for social engagement. Okay, another question from the audience. This one is for Candice. Another controversial one, Candice, brace yourself. Would Candice expand on her comments on the US elections that it was a referendum on science? In your view, has the pandemic changed the role of scientists as a key driver for science policy?
Yeah, so that's a great question. They'll be doing the post-mortem on this election for kind of years and decades to come. We still don't know the answer. But what was stunning to me were first the exit polls. So when people came out of voting and ranked why they voted in this election, what was the most important factor? You had the economy, you had important issues like racial justice, but COVID came much further down. you had two very different campaigns in terms of their approach to it. You had one campaign that held large rallies that turned out to be, according to a new Stanford study, super spreader events, a minimum of 30,000 new cases tied directly on a county-based analysis to those events and 700 deaths. You had chants that said "Fire Fauci," right? That's Anthony Fauci, one of the leading experts in infectious disease, at those rallies. You had another campaign that was promising to put facts over fiction, to have a scientific approach to addressing the pandemic. So I think everyone thought that the pandemic would be driving the votes. And as we're seeing, it wasn't driving it based on the reports. And certainly in terms of the vote tally, now voting is very complex with a lot of factors going in, but we clearly didn't see the kind of strong reaction that you would think when you have these very divergent approaches in terms of what the next pathway is. So the next pathway, for example, the Trump campaign, one of the main voices there, Atlas, has proposed herd immunity, which everyone else, any kind of thinking human being and scientist is saying that's not, a scientifically sound or good idea, and there will be an enormous toll in terms of death. And so I think what we saw in terms of the election was troubling for science and scientists. We're seeing a general sidelining of scientists, of top scientists. We're seeing the politicization of the Center for Disease Control, which should have been the shining light for potentially the world in response to this pandemic, that has been silenced. And we're seeing pushback from scientists and certainly people trying to work at the state and the local levels. But at this point, I would say there's actually a bit of a war on scientists and science in terms of the response to the pandemic in a very divided country. Now, how this will look next week, depending on kind of how this shapes out and what the future of science is in America, I don't know. But this morning, it looks dark. It looks dark to me.
It does indeed. Yeah. And we can only hold our breaths to see what happens over the next week or so. Thank you for that, Candice. Okay, question now for all the panelists, and this may be our last one. We're getting close to wrapping up here. So let's get to it, and I'll come to you each in turn. Reflecting on each of your unique science and policy leadership roles in responding to COVID, what has been your greatest learning and why? So Rémi, we'll start with you.
Maybe just before that, I will just add in terms of school, the Premier of Quebec very early said the school must remain open, primary school, high school, so we reopen in May. And of course, I must say that many others at the federal level and the province said, oh, these Quebecers, they are totally crazy. But he's really pushing very, very hard for that, and the social aspect is certainly very key. I think in terms of learning from the pandemic is that scientists from different part of the scientific continuum wanted to help. We're there to try to support our government in terms of learning more about the pandemic, being upfront, speaking about science, talking about science in a public place, engaging with our citizens. So certainly this was great to see that. Now we have to make sure that we will continue, so that we will not go back into our old shoes and just be comfortable again. So we change quickly. We need to make sure that we will have learned this from the pandemic, that citizens, at least don't know about the US, seem to be a bit difficult, but in Canada and Quebec, I think our citizens want to know about science, want to hear from the scientists, not just the elected official. And now I think many of the scientists say, oh, it can be fun to do that. So we have to find a way to reward those that are doing that in the future.
Thank you. That's a great lesson, and one of the really important benefits that has come out of the pandemic. One of those silver linings where we can see, regular citizens, members of the public, really start to be interested in science because of the role that it has played in our response. Young, over to you. What is something that you've learned? What's the greatest thing that you've learned, and why has it had such an impact on you and your thinking?
Probably I would say this collaboration inside and outside. including the international collaboration. That was the question that actually you asked, to me as part of this panel discussion. But I would say again that collaboration, I think among the scientists within a country, across countries, and across continents is very critical, because we can learn from each other, and we can learn from the mistakes and errors from each other. We can learn from the success, how to say, I think the unprimed success from each other. So, culturally, politically, socially, we are all different, but we can still learn the lessons from the, I think, the different practice of the, I think, the working together in the wake of this COVID-19. So that is the one, I think, the aspects that I keep learning. And then today's, I think, panel discussion, this is another good example of, why, we got to talk to each other and learn from each other across the Pacific, across the Atlantic. And the other thing I would say is that I think we got to seek humility. This COVID-19 is this very ugly creature, but it is also helping us to learn. We got to be more humble. And then when it comes to, this kind of, I think, the bizarre, I think, the outbreak, it showed us the lesson that, we got to accept each other, we got to learn from each other. And then that is another way of saying that we got to seek humility, and then support each other. Otherwise, I think we cannot survive from this kind of, I think, the outbreak. So that is the lesson that I keep learning. So that is another reason that I'm very happy to collaborate with colleagues like today and listen from and then learn from each of you and learn from the questions, I think, of the audience. And I like to keep learning from, I think, the people like you and then other people outside this, I think, the public platform.
Thank you so much, Young. Those are very personal reflections that you've just shared with us. I really, really appreciate them. And I think it speaks again to your point earlier about human factors, right? Science is itself a social endeavor. We're all social beings as humans, as citizens, as scientists. And, we can learn so much more from each other than we can simply by reviewing the literature, if any of us can actually keep up with the literature these days on COVID-19. So actually collaborating across borders, across disciplines is where we're going to have the greatest impact. I completely agree with you there. Christine left us a brief message before she had to go on how she would answer this question. What's the thing that she's learned? I'm going to read some of that, and then we'll come to you, Candice, to share your reflections. So Christine says, we're all learning as we go along. This is unprecedented, and we realize that we didn't have many of the things, the data, the tools, etc., that we might have wanted to have in place. The most important thing is to have the dialogue and to build the capacity and support the cultural change management that has to happen to position us better for future waves or the next pandemic. So she's really speaking to, recognizing that we didn't have all the resources and capacity that we need, but now is the time to start and build towards the future. Nice reflection there. Okay, Candice, you got the last word on this one. What's the thing that you've learned the most that's had the greatest impact on your thinking, and why?
So I think my observation straddles the research and the personal front, and that has been, we've heard a lot about the incredible frontline workers in terms of healthcare. We've heard less about education, those working in education, the teachers. So almost overnight, teachers, schools were pushed online into incredibly difficult positions to try and support young people on not only their education, but their kind of social emotional development. And I think we've seen kind of incredible and inspiring stories and examples of teachers rising to that challenge, of innovating, of going the extra mile to, kind of support students. We've all seen the drive-throughs of the teachers driving through neighborhoods so the children could see them, and you describing your children being back in the classroom with the teachers. And those are where, we have had a lack of investment like we do in terms of children and education in the response to this pandemic. But those individuals have been rising up every day to kind of make up for that that gap. And we need to do more to kind of support them as they start to put in the types of supports that will buffer this generation from the long-term impacts that we're also worried about.
Thanks so much, Candice. And I'll take this opportunity now to thank all of you, all of our panelists, for joining us for this conversation today. It's been wonderful and enlightening to hear all of your different perspectives and expertise. I think we had a really wide-ranging conversation, lots of different experiences at the table, so much that we can learn from each other and so much in common. So thank you very much, Rémi Quirion, Asaph Chun, Candice Odgers, and Christine Sham, who had to leave us early. It's been a pleasure to have our audience here with us today and to take all of your questions. And thanks everybody for participating, and stay safe and stay well. Thank you.
Thank you.
Thank you all.
Thank you very much.